Next slide. So what is the role of pharmacist in infection control? If you do have digitalization and automation of all the services of your pharmacy, most of the infection can be minimized or regulated. So for that, in case if we do fail for digitalization or for prescription and all automation of services, use landlines, mobiles, drop boxes, fax machines, and intra and internet facilities can be used so that the traffic within the pharmacy can be minimized by the colleagues and even patients. So if any patient, unused medicines are there with the patient, you just discard it, put it by the incineration. You have to discard it. Don't use it for other people. So no doubt social distancing and floor markings of 1 meter apart, everyone knows it. And the bulk packings can be made into a unit packing. So that is helps in easy administration for the patients. Then change in mode of drug delivery also. Instead of going for parenterals, if you go for IV push, so that the contact time and transit time will be less for the patient within the hospital. So even the change in drug delivery system will also change the infection control. If you are going to give IV injection, it will run for 15 to 30 minutes. So over a period of time, there is a possibility of getting cross-contamination. So in order to avoid that, all the IV fluids, wherever there is a possibility, go for IV push. That will minimize the contact time with the patient. Then sourcing and using of PPE kits and installation of hand sanitizer stations and plexi dividers in the hospital will minimize the cross-contamination. And finally, even pharmacists play an important role in helping the consumers, patients to buy the quality supplies. Already I said that the supplies coming under face masks, N95 masks, flexis, whatever it is. So all this comes under quality. So this is how the pharmacist can minimize the infection by changing the services in a hospital. Next one. Next slide. So CDC also issued guidelines for the pharmacy. No sick person. See, the pharmacy or healthcare workers should not be a source of infection for the patients. So there is a guidelines for pharmacy. Sick person should not report to work. There will not be any punitive punishment for the patients. Don't handle any kind of objects or documents of the patient. Non-touch process wherever there is a possibility. There is no need of PPE kits, especially for filling the prescriptions. But you can use face shields or face covers while doing prescription dealing. Then close contact services like vaccinations and COVID-19 testings. See that it should be properly fitted with a respirator. Then you have use flexi glasses in the hospital and pharmacy premises. Then there should be a separate drop box or there will be a separate counter for keeping medicine so that the patient can take directly. Don't hand it over the medicines to the patient. Then social distancing and sanitizer use, and these are the common, everyone knows it. Then finally, even it is better, encouraged to use self-checkout, drive-through or delivery services so that it limits the number of people entering into the pharmacy. So these are some of the guidelines are issued by the Center for Disease Control for the pharmacists.